your physical exam.
Yes, I know how important it is.
Yes. As I am examining certain parts of your body, I will be explaining to you what I'm doing and what the normal findings would be.
Okay.
You are very well groomed. You are complected appropriately for your ethnicity. Your mood matches what you're saying, how you feel, which means you have an appropriate affect. So the first thing I'm going to do with your facial and your head assessment is that I'm going to be looking at your skin, and I'm going to be checking your eyes to see the color of your eyes, the white part, the sclera, that can give indications of certain diseases like liver disease. To palpate your scalp. And when I do that, I'm going to be feeling if there's any tenderness, if there's any depressions, if there's any bumps or, okay. You have a normal distribution of hair growth. There is no baldness. You have a great head of hair.
I'm going to take a look at the back of your head to just make sure that we have the same findings. Okay, perfect.
Your skin is intact, free from lesions or redness or any abnormality. Now what we're going to do now is we're going to check for facial symmetry. So what I'm looking for is that all your features are fairly symmetrical, because sometimes if there is a droopiness on one side, that can be an abnormal finding. We also want to make sure that when you raise your eyebrows, that they both raise symmetrically. We also want to make sure there's no involuntary movements like twitching or tics or anything like that. So for this assessment, I'm going to be checking cranial nerve number 7. So the first thing I'm going to do is I'm going to ask you, turn your head down a little like that. I want you to raise your eyebrows for me and then make a mad face. Now relax your face. And I'm gonna place my thumbs over your eyes, and I want you to try to open your eyelids even though my fingers are on top of your lids. Perfect, strong eye muscles. Your facial movements are symmetrical and appropriate for your mood. For cranial nerve number 5, this is called the trigeminal nerve. This nerve, it innervates the face, and it helps with, well, it assists with allowing you to feel sensations, among a few other things. Okay, do you feel that?
Yes.
Okay, how about that?
Yes.
And how about that?
Yes. Yep.
Great, so this test that I just performed indicates that you have a very normal cranial nerve number 5. I'm going to assess another part of this nerve. When you open and shut your jaw, that nerve is part of that. So I'm going to put my hands on your temples, and if you could gently open and shut your mouth, indicates that you have perfect cranial number 5 abilities. We're going to start with a couple little brief tests. The first one is called the Rosenbaum test. This is going to test your vision, your close vision. I'm going to hold this 36 centimeters away from your face, and I want you to tell me the smallest line you can read covering your left eye.
LTFPH.
Okay, and let's do the other eye.
LTFPH.
Great. So now we are going to do the Snellen test, where you hold one eye and you tell me the smallest letters you can read.
LTFPH. LTFPH.
Great. Now you have just indicated to me by acing that you have 20/20 vision in both eyes. I'm going to perform the cover-uncover test, strabismus, which is when one eye deviates from the norm. So let's cover one eye. Okay. And cover the other eye. There we go. Okay, no indication of strabismus is noted. The next thing we're going to be assessing for is your extraocular movements. The nerves that innervate the muscles which help your eye move in different directions. So that is cranial nerve 3, 4, and 6 are those cranial nerves. On my finger without moving your head. And we're going to check the 6 cardinal areas of where your eyes would typically move. So down here. Now remember, don't move your head, just your eyes. Perfect. That is indicating that you have the appropriate and proper use of your cranial nerves 3, 4, and 6. I'm going to get my gloves for this and I'm going to perform hand hygiene. Let's turn the light back on. So what I'm going to be checking now is your eyelashes, eyelids, your conjunctiva, and your lacrimal apparatus, which is the part of your eye that produces tears. Okay, so first, look up for me. All right. The conjunctiva is pink without any undue redness or swelling. The lacrimal apparatus has no swelling or blockages or anything like that, and your eyelashes are well distributed. So that is very normal. No abnormal findings. Now I'm going to be assessing PERLA, which is an acronym for pupils are equal, round, and reactive to light. So the first thing in that series of tests is that I hold a light up and I'm looking at your pupils and I'm seeing, are they round? Do they react to the light? Do they react equally? And do they accommodate? And they do all of those things. So you are in the clear. The conclusion of that particular test indicates that you have intact cranial nerve number 3. Finally, I will perform a fundoscopic exam, which is looking a little bit deeper into the eye, which gives me an idea of the characteristics of the retina and the optic disc. It can help me distinguish whether you have certain illnesses, because certain illnesses like diabetes, you will have changes on the inner part of your eye. I'm now going to visualize your red reflex. Okay, looks normal. Your optic disc, there's proper margins. Let's look the other side. All right, open a little wider for me. Yeah, there we go. And your eyes appear without any internal hemorrhages or any issues like that. Next, we're gonna move on to your nose. First, I'm going to inspect the skin around your nose. I wanna make sure that there is no redness, discharge, or swelling. All right, everything looks good. I'm gonna palpate your frontal and maxillary. All right. All feels normal. There's no tenderness, correct? Okay, no pain when I do that. That is good, normal findings. The next test that I want to do is the patency of your nose. So I want to occlude one nostril and I just want you to sniff, okay? Okay. Both patent. And the last thing with your nose I want to do is that I'm going to put a Q-tip under your nose that has a strong scent, and I want to test that you can smell it properly. And this is testing your cranial nerve number 1. That's your olfactory nerve. What do you smell there?
Bengay.
That's right. Now we're going to be moving on to your mouth. What I am visualizing now is the exterior of your mouth, your lips, and they look healthy. They are smooth without any cracks or redness. And now I'm gonna move on to checking the inside of your mouth and make sure there's no lesions or anything like that. Okay, we're gonna pull that to the side. There we go. Okay. Everything looks pink and moist. Your tongue looks midline. What I want to do is look at the back of your throat with my light and check your uvula. And you can, and we're gonna put this back and go. You know what to do. Perfect. Your upper lip is very tight to your teeth, which may indicate that you have a tongue tie. What I also want you to do is stick out your tongue and move it from side to side. I want to make sure you have an intact cranial nerve number 12, which is the hypoglossal nerve, which helps the motor movement of your tongue. That looks good. What I also want to do is inspect your tonsils. Let me get a fresh thing.
I don't have any.
Oh, okay. So what I'm going to do then is I'm still going to look, but instead of looking at your tonsils, I'm just going to check your hard palate.
Okay.
Okay. I'm just going to hold that down a little bit. Not going too far because I don't want to trigger any gag reflex. Everything looks pink and moist. No exudate, no abnormal colors, and no strange odor. I'm going to palpate your preauricular, postauricular, tonsillar, mandibular, occipital, submandibular, and submental, superficial cervical, posterior clavicular nodes. Okay. What I'm feeling for is if there's any swelling. Typically you don't feel these too much when you're doing an exam. You actually shouldn't feel them, but if you do, they should be soft and movable. I'm going to check your carotid pulses now. Good. Normal pulse, +2.
Now I'm checking your tracheal position. I'm going to go behind you. Okay.
Now I'm going to palpate your thyroid, but for that, I'm going to give you a fresh glass of water and I'm going to ask you to swallow, and I'm going to stand behind you, and as you swallow, I'm going to palpate. It makes it easier to palpate that organ.
Me too. Okay. Not enlarged.
I'm going to auscultate your thyroid and your carotid arteries for Bruit's. No Bruit's noted. All clear. For your neck, we're going to be testing the strength of your cranial nerve number 11. And this innervates a lot of the muscles in your head and your neck, which help you shrug your shoulders and turn your head from side to side. So if you could put both your hands at a relaxed position. I'm going to put my hands up here and I want you to shrug against resistance. Okay, good. And then I want you to try to look that way. Good. And do the same over there. Good. Okay. All normal findings. Strong, intact nerve and muscle fibers. So what I'm going to do is I'm going to look at your back and I'm going to check your back for any lesions or any abnormalities. I want to make sure everything is symmetrical. Okay. All right. Everything's straight, spine is midline. All right. No abnormal markings or lesions or growths. Excellent. Now what I'm going to do is I'm going to check for your thoracic expansion, which is a fancy term for how your lungs expand when you take a breath. So if you could take a nice deep breath for me. One more time. Okay. Now I'm going to assess something called tactile fremitus. This is to see if there's any undue sound. I'm going to ask you to say 99 each time I touch your back.
99, 99, 99, 99, 99, 99.
Okay. Now I'm going to percuss over your lung fields, which means I'm going to do little tapping, and I want to feel the different fields of your posterior chest to make sure that it helps to determine if there's any abnormal things going on in your truncal area. And just take some natural breaths for me.
Okay, we're going to do the percussion. I'm going to take my fingers and I'm going to tap like that. And what I want to hear is a resonant noise, which I do. And that is normal in your posterior chest.
Now I'm going to test your diaphragmatic excursion. So what I want you to do is take a nice semi-deep breath, and I'm going to percuss over your diaphragm area. And I want to make sure that the excursion is the appropriate centimeter size, which indicates proper expansion. Very good. That is indicative of, I would say about 3 to 4 centimeters. 3 to 5. So that's good. The last thing I'm going to do for your back, aka your posterior chest, is to auscultate your lung sounds. Deep breaths. Lungs bilaterally. You have vesicular lung sounds, which are normal for your that part of your body, and that part of the exam is good. So now I'm going to auscultate your heart, and there's different parts of your heart that I am going to listen to. There is your aortic valve, your tricuspid valve, your mitral valve, and there's a little section called Erb's Point. Okay, everything sounds good. You have a strong sounding heart. You have an S1 and an S2, which is the lub-dub that you hear when a heart beats. And both of those sounds are normal sounding. There is no extra beats, no murmurs. So I'm going to check your neck for jugular venous distension. I'm going to check your jugular vein to make sure it's not distended. So if you could look up, just not too much, just a little bit to keep the skin still. I don't want it to be too tight. Okay, good. So there's no distension there, because the distension could be indicative of circulatory problems or heart problems. Now I'm going to auscultate certain arteries in your upper body and in your pelvic region, And I want to listen for the sounds that they make, and I want to make sure that those sounds are normal and that you have proper circulation in your major arteries.
Okay.
So lean back and get comfortable. So what I'm listening to now is the aortic artery. Okay. It was your renal arteries. No abnormal noises noted. Now I'm going to check your iliac artery. This is the artery that is just above the pelvic area. Okay, good. No bruit. Now I'm going to check in your groin area, the femoral artery. And I want to see if there's any pulsations. And of course, I want to make sure that there's a pulse going there. Okay, good. There's no bruit and there's no abnormal sounds, but there is a pulse, which is very important because we want to make sure that blood is going to those lower extremities. Finally, I just want to look at your arms and your hands. I just want to make sure there's normal hair distribution. Want to make sure there's no lesions or any other abnormalities noted. Of course, I'm going to look at your hands and your fingernails. Sometimes somebody's fingernails can be very indicative of their health. For instance, if someone has clubbing in their upper fingers and their fingernails, it is indicative of poor oxygenation, chronic poor oxygenation, but you don't have anything like that. And you are not a smoker, right, sir? Mm. So that's very good to hear. We're going to check your capillary refill, which is I'm going to lightly press on your fingertips, and I want to see how quick the blood returns. Very good. It is under 3 seconds, which is optimal. Next thing we're going to do here is I'm going to inspect your ears. I am going to look first at the exterior part of your ear. I want to make sure that there's no redness, swelling, or discharge. Then I'm going to look at the inside of your ear and make sure that they're the same is not going on the inside. I'm going to check your tympanic membrane, which is the thin membrane that protects the outer ear from the inner ear. And then I'm going to assess your hearing with a couple little tests. I'm going to look at the exterior of the ear. I'm looking at the auricle. I'm looking at the tragus. I am inspecting the pinna, which when I tug on that gently, you don't experience any pain, right, sir? Mm-hmm. Okay, good. And everything is properly complected without any redness or swelling or discharge. Let's see, let's turn this light on. Okay, there is normal amount of cerumen noted inside of the ear. There is a grayish tympanic membrane, which is normal. There is no bulging or swelling inside, and the tympanic membrane is intact.
So we're going to check and make sure it's the same thing on this side. Okay. All right. All normal findings. Normal level of cerumen as, late term.
Lastly, I'm going to be performing the Rhine, Weber, and the Whisper test. This tuning fork to perform the first 2 tests. I am going to ding this, and it's going to emanate a noise. So I'm going to put that right here on your head. And I want to see if you can hear it louder in one ear or the other, or if you can hear it equally in both ears.
Equally.
Okay, good. So we have passed the Weber test. That test concludes that you have no sensorineural hearing loss, which is a true hearing loss in your ears, as opposed to just conductive hearing loss, which would be earwax or an occlusion. All right, I'm going to use this tool again. I am going to make a noise, and I'm going to test each ear separately. I want you to tell me when you stop hearing this noise. Stop hearing it?
I stopped hearing it.
Okay, good. And then I'm going to make a noise on the same ear, and I want you to tell me when you stop hearing that noise.
Stop hearing it.
Okay, good. That is a normal finding, which means that you don't have conductive hearing loss. Because if you heard the bone conduction when I put it here, if you heard that longer, that could be a problem, but we don't have that. And I'm going to do the other side now. I'm going to stand a few feet behind you, and I'm going to whisper things, and I want you to tell me what I said. Okay, I'm a few feet away. 1, 2, 3, 4, 5.
1, 2, 3, 4, 5.
Okay, your left ear has passed the whisper test. Okay, next ear. 10, 9, 8, 7, 6.
10, 9, 8, 7, 6.
Excellent. Okay. Well, sir, I just want to thank you for coming in for your physical exam today. All right, sir. So that concludes our physical exam. Is there anything else that you'd like to discuss with me today before the end of your visit?
No.
Okay.
Thank you.
Okay. Well, I just want to thank you for coming in and staying on top of your health.
Thank you.